This episode of ChatGPD was made possible by the hard work and creativity of our production team. A huge thank you to Chris Sang, Alakia Chandran, and Shakoyak Forazan for their expert production, editing, and behind-the-scenes magic that brings each conversation to life. We also want to thank Saratoga and the IMS for their support in helping us share ideas, stories, and resources that empower our grad students at every stage of their journey. Hello and welcome to another episode of ChatGPD, our podcast on careers in biomedical science. My name's Pamela Plant and I'm the Director of Graduate Professional Development here at the Institute of Medical Science at University of Toronto. And I'm here with our today's guest, Serena Peck. Serena is the Program Development Consultant with Island Health at Vancouver Island Health Authority in British Columbia.
Yeah, a bit of a mouthful.
Yeah, I know. Thanks for that, Serena. Welcome to today's podcast.
Thank you so much. I'm super excited to be here.
Yeah, and we're super excited to have you. You were a bit of a star in your graduate studies at IMS, and we're very excited to hear about your journey. But before we talk about your journey, I would just like you to talk about your role, because for our listeners who don't really understand what a program development consultant is, could you just talk at a very high level about what it is you do?
Yeah, of course. I know the names are sort of a mouthful. Really, what I do is probably program quality and implementation, I guess is a better maybe way to say it. So I work for the Vancouver Island Health Authority. In British Columbia, there's 5 health authorities. And so Vancouver Island is where I live. It's off the coast of Vancouver. Probably never heard of it. Maybe you have. It's quite a large island. So we have, I want to say maybe 500,000 people. But that's probably wrong, but it's large enough. I live in the capital city, which is Victoria. And what I do is I'm on the regional primary care team. So primary care being, your family doctors and health. And I work with the rural and remote communities across our island. So Island Health, as a health authority, we own and operate clinics, primary care clinics across the island. And we also work in sort of contracts with third-party clinics that may be run solely by smaller rural communities. So that is sort of like community health societies that run clinics, and we maybe work and we pay for a lease or we bring staff over, that sort of thing. And then in my role, I'm responsible for the strategy and some of the operations pieces. So, which again is very broad because every day is very different, but mainly it's problem solving. So when there are problems, like the biggest problem, as you can imagine, is shortage of family physicians. Yeah. And some of our communities are really struggling and maybe only have one physician or a part-time physician. A lot of our communities only have nurses. And so it's figuring out how we can best bring care to these communities and sort of make it work while we're trying to recruit. And so a lot of that is strategizing and working with other communities and clinics and sort of trying to figure out how we can fill vacancies. And then a lot of it is actually implementing some projects on the ground in a few communities. And so that's when you really get to work with a clinic itself and the community members, which is really important. It's really, really fun work as well because I get to actually engage with the community members.
That sounds so important. And communication is what comes to mind, like those strengths that you would have had, that you did have when you were in grad school, that you're really exercising now. Mm-hmm. But I want to go to the day-to-day. You mentioned it yourself. Every day is different. What do typical days look like across a week? What kind of things are you doing?
Yeah. So I work remotely. So my team is spread across the island. So I'm mostly in meetings. I am in either working groups where we're doing sort of that active problem solving. I do a lot of policy work as well. So I might be writing policies, bringing policies to groups to get approval, presenting the policies to different interest holders, or I might be writing reports. And so we work a lot with the Ministry of Health. And so we get information flowing down from them, or we might also have to bring problems and escalate them up. And so a lot of the things I would do are writing what are called briefing notes, where we summarize some of the issues that some of the community members or different clinics or what have you are bringing forward, and we're presenting sort of our recommendations. And what can be challenging is they may or may not take our recommendations. And so it's sort of an iterative process of we're responding and working with the ministry a lot as well in our work. So sometimes it's a week is I'm quietly doing, my writing in my meetings. And then sometimes we're escalating things and there's a problem that needs to get solved. And so things are getting really more intense. So it's kind of fun. I like the variety because really it is different all the time. And other examples right now, it's March. So it's our year end, like our fiscal year is ending. We have a lot of contracts that are also up for renewal. Okay. So right now I'm also focusing, a big thing we're trying to do is standardizing our contracts for different community types. And so I'm doing a lot of work with our different teams, our contract management team, our finance team, and we're trying to make sure that we're renewing all the contracts, people are getting paid, but also we're looking ahead long term to make sure that what we're putting into practice isn't going to come, have problems later on, basically.
And how much communication is there with the other health authorities? So you said there are 5 across the province. Mm-hmm. I just have this probably very naive view that BC involves a lot of rural and remote health because the concentration of the population is around the Vancouver area and Victoria area. How much overlap is there between your health authority and others? Is there, collaboration across those? Do you communicate with them and make sure that a lot of the contracts are similar format and there's consistency across the different health authorities? Or are you kind of working autonomously?
We do mostly work autonomously. And my understanding, I think it used to be one health authority before I lived there, and then they broke it up into sections. So we are kind of working on our own things. We do reach out to other health authorities for some things. So for example, the contract work I just mentioned, we have reached out to the other health authorities to see what they're doing in their contracts. Are we writing the same things, etc. For the most part, we're working sort of in silo. However, we also have the First Nations Health Authority, which is the only First Nation specific health authority anywhere in Canada. And we do work closely with them. So anytime, especially in my role, we are implementing any projects or doing that sort of on the ground work, there should be one of their representatives in, the working groups or the meetings for that as well. And we do also collaborate sometimes with Northern Health. So Northern Health Authority, you can imagine, it's the northern of BC, where pretty much everything is rural and remote health. So I've reached out to them a few times to talk about some similar issues. And funnily enough, we don't actually have very similar issues because the landscape and the infrastructure is just so vastly different. It's really interesting. And it's mainly because on Vancouver Island, or an island, we're surrounded by water. A lot of our communities are either fly in or boat in only, whereas Northern Health is mainland. And so some of them are fly in, but most of them are drive in, even though it's like logging road drive in. So we have these really unique differences on our island, and a lot of the really unique communities where it's kind of really hard to get access. And so we do have communities where we are helicoptering out physicians only a few times a year. That's the structure right now. And we have some that we have a nurse go to one community and then take a boat and drive or boat across to another community. And so there's so much complexity going on there.
So that just kind of answered my question about why the point of the 5 individual health authorities, but who would have thought that geography actually influences implementation? Like in Ontario, it's maybe, again, naively, a very homogeneous. I think there is rural and there is remote, remote and urban. It's kind of the gradation of the 3, but it sounds like in BC there's such nuance to delivery of services based on geography.
Yeah, and it's really interesting because even we have some communities that are maybe 30 minutes apart in distance, but the the makeup of the communities are extremely different. And so we have some communities, maybe primarily First Nation communities. We have over 50 distinct First Nation communities across our island.
Wow.
And so we also, our clinics are also then serving many different nations and many different reserves. And so there's a lot of just in general overlap of work. Again, working with the First Nation Health Authority, there's what's called also First Nation primary care initiatives. There's a lot of work going on, and we're really trying to support everyone and collaboratively work together. But it's just really interesting that the distance between some of the communities and they could be side by side are also just vastly different. And so it's really interesting. It's been really fun to learn about it. I've had the pleasure of traveling to a lot of the communities as well to actually see that firsthand. And I love it. It's just really interesting.
So beautiful segue to how you got there.
Yeah.
And it's a long way from Toronto. It's a very different environment than Toronto, and in particular in grad school in the IMS. So where did you go after your grad? Talk a bit about your graduate degree and then the steps you took to get to where you are.
Yeah, I might even go back a little further. Because I think, my story, I don't know, it's not much of a story. It's sort of all over the place, but I had, my undergrad was in kinesiology. So I'm actually a kinesiologist as well. And I did a lot of clinical work in our hospitals, in our Women's College Hospital. I worked in cardiac rehab. I worked at Princess Margaret Hospital in cancer rehab. And so I really always loved working with people on the ground, and I loved the sort of program development. And now here we are, I'm a program development consultant. So I think it sort of stemmed from that area. But I was also really involved in research as well. So
that was during your undergrad.
that was undergrad.
Yeah,
and so I had lots of clinical and research experience, which I'm very, very thankful for. The programs here were incredible.
Yeah, that was naturally a part of your program. That was in an extracurricular.
Yeah, that
you
was
sought
embedded. It was phenomenal. So research, then I was also working at Toronto General in the Peter Monk Cardiac Center in the summers, I think, in cardiology research. And then I sort of bridged both of the cancer and the cardiology together. And my master's degree was in cardio-oncology. And so throughout that degree, I was really, I guess, hyper focused on this one area of work. And there was, I don't know when it happened, but there was just a thought. I think I stepped back for a second and I thought, well, I could continue, down this path. This research is incredible. It's like this very niche research area. And we were sort of the first ones, doing the work in this area. And I could do my PhD or I could do my MD. I could do it all if I wanted to and sort of follow the footsteps of all the people I'm working with. And I sort of just thought, well, I really just love working with the kind of, I don't know, the everyday population, just like the average Canadian experience. And I was just getting so narrow in focus. I knew everything about cancer and heart failure and exercise for cancer and heart failure. And I thought, I really just want to kind of help everybody. And so that sort of started me thinking, well, maybe I want to get more practical experience. And then also thinking, I don't love living in the city. I'm not a city girl. I really didn't picture myself ever being here, but I was living in Toronto. And so I thought, well, I think, I'm going to start exploring. Maybe I'll move somewhere else. And I had a friend who was doing school in Victoria. I had been there once to visit another friend one time. And I just sort of decided that's where I'm going to go and that's what I'm going to do. And so I moved there, not having a job or anything. I just honestly packed up and thought, I'm just going to go on this little adventure and hopefully find a cool job. And this job posting came up and I thought, this is exactly what I want to be doing. I want to be working with more rural populations. I love this sort of like problem solving and quality work. I don't know, the universe sort of put it in my lap and everything aligned.
Well, that's one strategy is just jump off the cliff and hope there's water at the bottom.
Yeah, just believe something will happen and figure out. That was 100% what I did.
Good for you. But you had so many skills you developed in your grad degree.
Yeah.
I mean, I've heard about you. You're a bit of a legend. So can you talk about some of the enriching experiences aside from your thesis work that you did? One that comes to mind is this Health Innovation Challenge, which you pioneered with Kayvan Afleki, who is a fellow MSc. And I was just wondering if that kind of planted the seed of careers in healthcare consulting, because that's very much aligned with kind of what you're doing now, that innovation and
Yeah.
particularly this year's theme in remote and rural medicine. So can you kind of walk us through those experiences in grad school and maybe how you leverage those into the current position?
Yeah, I think that one for sure. The creating and applying, as we won the Temer or the J Keystone Award for that program. I think that was another example of how I kind of knew I loved creating things and designing things. So when we saw the opportunity to, create a knowledge communication program, I was like, well, I love doing this stuff. Of course, I'm going to apply. I actually had 2 applications go to the final round for that. I just wanted to make up anything I could. I love creating things. And so I think that was always just inherently what I liked doing. And I knew that was also something I was good at. And so we ended up winning the award and we implemented the program, and it wasn't a one and done sort of situation. I just knew that I wanted to continue doing it. And it was accumulation of all the communication skills, really the problem solving, the creative thinking. I just was sort of letting it all flow. And that was a great experience, and it continues to be a great experience. I probably
just for our listeners to let
Yeah.
them know that you're still involved
Yeah.
with the organization,
Yeah.
the leadership committee on that.
sitting on the committee, like I just really enjoy that kind of work. And so continuing on and doing that. In IMS, I was also one of the co-presidents, also with Kayvon, for IMSA. And I think that also just the communication, the leadership, like the managing and organization skills sort of practice throughout that, really contributed to what I'm doing now. But I also think when I was sort of making that decision of what do I want to do next, I think it was really important to recognize, and this may be helpful for some students too, to recognize what are the parts of grad school you actually are really enjoying or maybe lighting you up. Because I was a good researcher and, I won research awards and I liked the presenting, but actually didn't love the writing of the manuscripts, nor did I love the data analysis, which is mostly what research is. And so I could have went down that route and continued on, but I sort of recognized, well, I'm having the most fun when I'm presenting at conferences, or I'm leading my PAC meetings and we're having these discussions, or when I'm doing these extracurriculars where I just get to create things and lead things. And so that's really important, I think, to recognize what pieces of your work do you enjoy and what lights you up. Because it's very easy, I think, to be down, focused on what you're doing and sort of have the blinders on, or whatever metaphor you want to use, and kind of get lost in it. And so I think recognizing all the things that you're enjoying is really important too.
I think one theme that comes up pretty much in every podcast, because we do have all of our guests are graduate degrees, have graduate degrees in some biomedical science. And the theme is coming up time and time again, that it's the kind of person you are and how you approach life and how you approach problems. That is what you are bringing from your degree. It's like, okay, I'm confronted with a problem. You research the problem, you come up with a hypothesis, you do mini prototyping experiments to try to support the hypothesis, and then you kind of readjust your hypothesis or your theory, and then you go on to the next problem. So it's really your approach in life that creates this extraordinary kind of worker in any job. It's that lens that you are bringing that makes you an extraordinary employee. And I would love for you to comment on that in your current role. You said so much of it is problem solving. So you're applying your scientific lens and your well-honed ability to kind of research problems to try to find solutions. Aside from that, are there any other kind of technical or hard skills that you use in your everyday job that you grew in your degree?
I think probably the main one would be sort of silly, but like making really good PowerPoints.
Okay,
Really,
that's not silly at all.
The technical communication piece, including how to, lead meetings and make effective, whether it's reports or PowerPoints. Those skills I really refined in my PAC meetings. You refine it throughout your career. If you're in conferences, if you're doing how do you present information in a way that people are, one, going to listen, they're going to take the main takeaways, and you're also not going to bore them.
Yeah,
And
it's
so,
exciting.
yeah, I think that was something really strong coming in. I could easily jump into any meeting and sort of lead it because I had all of this experience and all this practice from grad school. And you might think because you're in it, everyone has that skill, but they don't. And it's some people, they do have to practice that really hard. And so that would probably be not really technical skill, but it is one of those communication skills that I noticed I had pretty strong going into it, into the workforce, I guess.
So you say you design evidence-informed models of care, and I would like you to kind of expand on that and explain what does that look like in practice from concept to implementation?
Yeah, I guess like the evidence we use is sort of, I guess it's different than academics. It's depending on the projects and the programs you're using. So some of the data we have is either from our clinics ourselves that we're collecting, or it is Ministry of Health data that is actually not always the same year after year. If they decide we want to collect different things in our databases, we're switching up what we're collecting and what evidence we have. Sometimes it's looking for other health authorities or different provinces and what they're doing and if they've published any papers. And so it's interesting that the data that we're gathering for each project is really different. And that's something that is different from academia, because it's truly, when you design to do a project, you're designing it from beginning to end. And we're doing a lot of this, I guess, retrospective, finding the data or trying to look for what we can collect and then put it into practice for our programs. And a lot of it is also just working with it in hands-on. We're practicing as we go. And so I'll give you an example. We did a virtual care project in one of our remote communities. And we thought this was going to be great. All the data says virtual care is, helping with access. People usually are have a good appetite for uptake. And so everything was pointing us in the right direction. And what happened was the community we were implementing it in, the community population didn't want it, didn't want to use it. We even provided people with tablets and they could take them home. There was apps, they could come in and someone could sit on the, virtual device with them. Nobody wanted it. And so it was so interesting that also the data was pointing in like virtual care, all this technology is really going to help, but it didn't. And so we had to sort of pivot and we changed our project and we did some other things. But it was just a great example of how sometimes, in the real world or in practice, sometimes the evidence and the data actually doesn't match up to what you're going to do.
Absolutely. And that would be the fascinating problem solving aspect of this, because you kind of translate the data and the policy into practical, implementation procedures in rural and community, but you really have to understand the population that you are serving. Mm-hmm. And like you said, it might be different in different, like you're both remote, but you might be very different philosophically. So how much anthropological work do you have to do within that community to really understand? Do you do focus groups? Do you go and live with the community or kind of poll the community? How do you approach that?
Yeah, for that specific project, we realized we obviously made a mistake and we didn't do enough actual on the ground speaking with all the community members work. I think we did some surveys, but we really didn't go to the more deep, detailed level. And that really is the most important thing when you're doing any kind of work, especially with First Nation and Indigenous communities, is hearing the voices and understanding the community needs at their level, not from what you think they need or what you think may help. It's really working with the communities. And so that could be focus groups. We actually don't call them focus groups. And it's really interesting. It's a whole learning, and I'm still learning how to, respectfully and culturally safely engage in communities. Some people call them like walk with me's. And so it is, you walk with members of the community and you're not taking notes, you're not recording or anything, you're just hearing the experiences. And that is your, data collection per se, but it's in a much more respectful and, non-Western way.
Culturally sensitive and community informed. Mm-hmm. I guess what I would worry about is when you get back to your office and you're trying to translate those thoughts, there's always kind of, the fear that Western bias is going to influence what you actually write down
Yeah.
from the interview. It's too bad that they're not kind of more kind of consensual ways that you could record the conversation so that it's not being filtered or kind of distilled by a Western bias. But I mean, it presents a very unique challenge with implementation in these communities, and it sounds like it's very unique to BC. I don't know that anywhere else in Canada you would have that kind of partnership with the Indigenous communities. Can you
Yeah.
comment on that? Do you know much about, working with Indigenous communities in the other provinces?
No, I mean, I wouldn't have any firsthand experience across other provinces, but I do know just, uh, especially with the creation of the First Nation Health Authority in itself, there really is such a strong presence and respect for including the Indigenous communities in the decision making, in the process, and the communication and everything, which, would love to see happen across Canada as well. I think it was a big learning coming from Toronto, where maybe some of the education wasn't at the same level as what I got finding when I moved to British Columbia. We take a lot of training, online modules. I was given the opportunity to also do an in-person learning experience in healthcare safety and Indigenous Healthcare Safety Day. And so there is a lot of emphasis on that, I would say, in the workforce, especially in the government role, but even in non-government roles as well. It is very prominent, which is great.
Do you think that BC model is going to eventually translate across the country? Is that the hope?
I
Or,
don't know. I really don't. I think the provinces are quite siloed, which, is unfortunate. And we could have a whole conversation of how the connectivity of all the provinces and Canadians, would be helpful. But I think we can learn from each other. And I've been to conferences where I've met people actually from the other coast and the Atlantic coast. And we kind of had similar problems and we, exchanged some problem solving strategies. And so I think learning from each other is so important. And there are some avenues for that. But I think it would probably be beneficial to have more of that as well.
and what do you think are the biggest challenges when you're working with clinical leaders and administrators and executive decision makers and kind of maybe with competing ideas of what is best? How do decisions ultimately get made, and what are some of the biggest challenges in working with what may be very disparate ideas?
Yeah, I think the biggest challenge is sort of, from my perspective and in my role, I'm really always trying to advocate for just the patient and the community level experience as someone who's probably, in the hierarchy at the level where I get to have the most engagement. And that always, is translated up to the decision making tables. And so for me, that's sort of, I guess I personally not struggle with, but I have to remind myself that that's one of the biggest challenges is sort of making sure the voices of the people I'm working, for are getting heard. And when that's not the case, it's just, I'll keep trying the next time. And so I always, to myself, make sure in every meeting and every, group I'm in, I remind everyone in the room, what we're actually trying to do and what we're trying to do for the betterment of the community. Because, conversations and decisions can be political, they can be financially driven. And so I'm just always the little voice in people's ears of, remember what we're doing this.
Don't forget the people.
Don't forget the people. And so I pride myself in that. I always try to make sure that is mentioned in every conversation.
That's very rewarding. I mean, that's always having that at kind of the core of who you are, what you do with your why. That's really rewarding.
Yeah.
I want to go to kind of practical advice for our graduate students and postdocs, our listeners who are thinking of science policy. And, how do you get exposed to science policy at a meaningful level where you can really kind of try it on, see if it's right for you, see if it's engaging, gain some kind of practical skills that you can strengthen an application into this type of position? Do you have advice for grad students and what they can do to kind of bolster their experience, their skills, and something that may make them more attractive for these kind of positions?
Yeah, I think it's really important. This is something I did, and I think it worked, honestly, is if I was interested in something, I just sought out any possible opportunity that was available to me to get involved. So throughout graduate school, I was on committees and in programs completely outside the University of Toronto, completely outside of our kind of ecosystem here, just getting exposure to things. So I would
Could you
just,
talk about some of
sure,
those?
yeah, I did a climate justice program. I found it online, didn't really know much about, climate justice or change, but I was involved in this program where we learned uh, basically how to create programs for communities. And we got training in design thinking, which is a way basically it's kind of like the research process. You're sort of like iterating and learning.
Innovating.
Yeah, you're
Yeah.
learning from your mistakes. You're refining your problem and whatnot. But we got training in this, and then I started a program. I'm gonna forget what it was, but it was a cycling ambassador program for underprivileged community across Toronto, and I forget where it was. It might have been somewhere in Scarborough. We worked with Cycle Toronto, which is a big nonprofit here, and we implemented this program. And so I got more exposure to sort of program design, implementation, working with interest holders. And Cycle Toronto was an organization that was really involved in sort of policy and politics, and I got exposure to that. And so that was just one opportunity I took, completely unrelated, that really is just helping build skills.
So really what I'm hearing is grassroots organizations that will give you exposure to policy implementation, just dipping your toes into those waters so that you can understand how processes are influenced by government and how implementation of programs is also organically developed.
Yeah.
It sounds like a really good skill set, but not necessarily within the realm of healthcare. Are there opportunities within healthcare? Are there science policy organizations that you can join that you're aware of that?
I'm sure there are. I remember looking a lot at like the public health and global health departments, and I think I applied for a few programs in there as well. And so I think it's really keep an eye out. And I think I joined listservs and email lists, and anything that would pop up, I honestly would apply. And I would just welcome the opportunity to learn something new. And again, if it's not even in the science realm, you can still learn and apply a lot of the skills, even if you're in something else, which I don't know that we think about a lot, because it's really hard to sort of wrap your head around stepping outside of our healthcare and our science bubble. And a lot of people thinking, it might not look good on your resume or whatever. None of that stuff matters. If you're asking me, I think do whatever you want that's interesting. And it's also maybe also advice is you can tell your story in any way that matters. I think my journey is so unique, and everyone's journey is so unique. I started as a kinesiologist working at rehab, and now I'm in a different province, working in rural healthcare, and you don't have to sort of follow the stream that everybody else does. And I think learning how to tell your story and sort of have your brand or whatever you want to call it is an important skill as well, and sort of just tying and understanding who you are and what you want to offer.
What motivates you? Yeah. And I think speaking to that, even more of a reason to go outside the mainstream of our labs and the medical realm to really distinguish yourself, because that is a plus when you're bringing unique perspectives and unique experiences to the body of your work and your resume and who you are and what you stand for. So even more fulsome a picture. Would you be able to talk about where you go from here? Where do you go in your career? Like what's considered a promotion? Where do you move in 5 years? What do you envision for yourself? Are you always going to be involved in program development and policy, or do you still see yourself pivoting to something else?
Yeah, I think personally I'm open to anything that happens. And so I don't really have a plan per se. I would love to explore whatever I'm interested in, whether that is more the policy route, whether that's law, or, maybe more politics, or maybe it is going back and doing something more like medical school if I wanted to be more clinical. So for me, I'm open to anything. Practically, for people who work in government, you can kind of go up into different jobs. So the level above me would be a director position, and then you have executive directors, and then you have sort of like the vice president and CEO of, similar to like a hospital kind of a setup. So that could be a pathway. For me, though, honestly, I know I'll keep doing something. I'm probably going to pivot and do something else, and I'll probably go back to school. Don't know what it'll be for, but I think I know I'm going to keep carving my own little path and change it up, because why not?
That takes a lot of courage and maturity
Yeah.
to just accept and trust that you trust yourself to assess situations and know what is right for you, and not necessarily knowing exactly where they're going to lead, but you know that it feels right for you and it's an opportunity you need to take. Is that fair to say that's kind of your MO going?
Yeah.
Like, it seems like you're that kind of person that just trusts whatever falls into the somebody who moves out to the West Coast without a job and says, we'll work out.
Yeah.
That takes an inordinate amount of maturity and trust. I really admire that.
Thank you.
And that sounds like that's what you're going to do in the future. It's like, if the opportunities present themselves and they feel right, then I'm going to go with that.
Yeah, I think I know at my core what I love doing, and it's advocating for people who need healthcare or help, mostly healthcare, because that's the space I've been in. And it's being able to design or lead programs or organizations, and building and being creative. So if I continue to find things that light up those parts of me, I know I'll be happy doing it. And I think really it's not maybe what I'm doing, it's if I can satisfy that sort of like internal gut feeling that I know that's what I'm supposed to be doing.
Who you are.
Yeah, really.
And
who I
that
am.
goes back to your brand. So what would your brand be in like 1 or 2 sentences?
Oh, that's a great question.
Yeah, sorry, I'm springing that
That's
one
okay.
on you.
I think it really would be designing something that helps people. That's all I want to do. Whatever it looks like, whether it was being a kinesiologist and designing and helping women with exercise programs and designing care for them, whether it's the Healthcare Innovation Challenge, designing a education program so students can then help other people, or if it's designing programs in our rural and remote communities to help the communities on the ground to just access healthcare and have better health equity across the system. I'm happy with all of it. And I would love to do all of it as well. I don't like doing just one thing.
Yes, I get that sense.
Yeah.
Yeah, it sounds like that creativity aspect is really important for you.
Yeah.
Do you have an artistic side?
Not at all. I
Okay.
think that's where it all comes out. It is just designing and sort of thinking. My mind is very much always going and always turning. I don't have any like artistic ability at all.
I would argue otherwise. But it sounds like you wouldn't, if you could do it all over again, you'd do exactly the same thing because you've always kind of satisfied your own terms in what you do. And is that a true statement?
Yeah, I think no regrets. I think I always just said yes to opportunities that presented itself, and I followed something that I was interested in. And yeah, I just said yes to everything. And then I think, look what happened. I got a lot of things done, and I got to go do a lot of cool stuff.
You figured
and help
it out.
a lot of people.
And you're so young, and yet you've done so much, had so many lives. Well, we're at the end of our time, and what we do at the end of each of our podcasts is get our guests to do a 1-minute pitch to our listeners about why they should consider a career in whatever the guest career is. So could you, in 1 minute, pitch why a career as a program development consultant is a great option?
Yeah, I think if you are someone who likes problem solving and you like variety and you like working with people and communicating and having conversations and problem solving with others, not just yourself, kind of this government policy and consulting work is a really good avenue to do a lot of things and do a lot of good.
All right. Serena, thank you so much for
Thanks so
coming
much,
in. I've
Pam.
really enjoyed our time.
Me too. Thanks so much.